Welcome to the National Indian Regional Extension Center, California. This is the third of 4 tutorials on how to attest to Stage 1 meaningful use on California's state-level registry. Congratulations on completing core measures. You may now report on menu measures. To complete the menu measures, you will need the following: the meaningful use report generated from your EHR, the clinical quality measures report generated from your EHR. You also need to know the source of the extracted patient records. Note that exclusions are based on all patient records. Take an exclusion if it applies. An exclusion does not prevent a provider from achieving meaningful use. Congratulations on completing core measures. You may now report on menu measures. This uses the same meaningful use report as used in core measures. Click on the box for the measures you have chosen. A total of 5 menu measures must be selected. Of the 5, at least 1 must be a public health measure. If you choose both public health measures, then only 3 more measures need to be selected from the additional measures list. On this report, the column shows the required Stage 1 target level that must be met. This column shows the current reporting period to compare with the target level to determine if the measure has been met. Clicking on the arrow next to the additional measures will bring up the specific objective and menu description. For immunization registry, there are 2 exclusions. If one or both exclusions are yes, it does not prevent the provider from meeting meaningful use. Each exclusion is based on all patient records. The first exclusion applies to a provider who did not perform immunizations during the reporting period. The second exclusion applies if there is no immunization registry that is able to electronically receive the information. Click on this link to see more details on immunization registries in California. For exclusion number 2, a screenshot from the California Department of Health website that shows that no immunization registry exists for the county would provide documentation. If you are able to transmit the immunization records, a screenshot of the successful transmission would serve as documentation that this measure was met. For measures such as immunization, or if an exclusion is taken, it is a good idea to upload the documentation for those measures on the same page as the measure. For measures that require a numerator and denominator, the meaningful use report uploaded will suffice. For drug formulary checks, the exclusion applies to a provider who has written less than 100 prescriptions in the reporting period. Otherwise, answer the question of whether the drug formulary check function was turned on in the EHR and there was access to at least one internal or external formulary during the reporting period. For the measure clinical lab results, the exclusion applies to a provider who does not order lab tests that display results in a positive, negative, or numeric format during the reporting period. If the exclusion does not apply, enter the numerator and denominator from your meaningful use report. The menu item condition list requires that you indicate the source of the data, either all patient records including patient records not in the certified EHR, or only patient records in the certified EHR. Answer yes if you have created at least one report listing patients with a specific condition. Type in 1 or more conditions on which the provider has run a report. The list itself does not need to be attached as supporting documentation. Please remember that no PHI should be uploaded to the SLR in the supporting documentation. All PHI should be blacked out. For the measure Patient Education Resources, enter the numerator and denominator from your Meaningful Use report. When you have finished entering data for the menu set measures, it is highly recommended that you upload the Meaningful Use and CQM reports as supporting documentation in the attachments box. Congratulations! You have just completed the section on menu measures. Next, go to tutorial number 4 to see how clinical quality measures are entered into the SLR and to submit your attestation.